Hello, I'm Alicia, a PhD student at Columbia University. Today I'll be presenting findings from pilot interviews about the influence of parental sex communication on contraceptive use in Asian American women. A lot of public health research has established that parental sex communication is associated with safer sexual behavior, but a limited body of research indicates that such communication is lacking in Asian American families, with young people reporting that it barely happened at all or was prohibitive rather than instructive in nature. Some large survey studies assert that Asian Americans are at lower sexual health risk because they're generally sexually active at a later age, but delayed sex is not necessarily safer sex. I'm interested in being more precise about indicators of sexual risk and in distinguishing the socialization of US-born and foreign-born Asians. In advance of my dissertation, I decided to conduct a pilot project to answer this research question. How does parental sex communication affect contraceptive choices and access in young Asian American women raised in the US? I conducted a small number of qualitative interviews to answer this question, and I tried to include ethnic and geographic diversity among participants, but I recognize it's still a very small sample that isn't totally representative. Through the 5 interviews, I identified a very general trajectory. First, every participant reported either limited or prohibitive parental sex communication, which was in line with previous research. Second, this style of communication instilled a fear in participants of their parents finding out about their sexual activity and of incurring emotional or financial harms as a result. Finally, this fear led to women perceiving additional barriers to obtaining their preferred methods of contraception, as they had to weigh the health risks with the social risks imposed by their parents. I want to highlight one story from the interviews to illustrate this. Arati is a South Asian woman who said her parents were close to their Indian roots. They openly discouraged dating during school, much less sex. When Arati started dating in college, she thought, I did not want any evidence that could lead to them finding out. She would rely on her partners to have condoms since she was too paranoid to even buy them herself. She ideally wanted an IUD, but said that wasn't in the cards since she was afraid of it appearing on her parents' insurance. Arati was actually studying a healthcare field and had more knowledge about sexual health than some other participants. For those without that specialized education, obtaining contraception can be even less likely. These findings indicate that even with high education or health insurance, Asian American women may find sex both more emotionally fraught and physically risky, with barriers to obtaining contraception due to the stigmatizing sex communication they receive from their parents. This indicates that Asian Americans are not as low risk as some might think, and it calls for more research on immigrant origin groups and the impact of biculturalism on health, which I hope to contribute to with my future and larger dissertation study. Thank you so much for listening, and feel free to email me if you have any questions or feedback or if you want a copy of these slides.